Good afternoon, friends. Welcome to this first show of Ask Me Anything with Dr. Sonika Kishan. Today, in this first session of Ask Me Dr. Sonika Kishan, we will address your issues with sleep and sleep related disorders. Please feel free to ask any questions which you have. We are already receiving few questions. We are counting those. Please keep on sending us the questions. I have the pleasure of having Dr. Sonika Kishan with me. Good afternoon, Dr. Sonika.
Thank you so much. Nice
Uh,
to be at the show.
Thank you for being with us today. Dr. Sonika Kishan is a leading consultant in Ayurveda. She is a writer, she is a poet, she is a speaker, and she is also, a speaker on health and healthy living. But without adding on in that list, I would rather request Dr. Sonika to talk about herself. Yes, Dr. Sonika, it's all yours.
Thank you, Mr. Arjun. Hello, friends. I'm Dr. Sonika Krishan, and he's just told you a lot about me. But I'll just add up that I'm an author also. I've authored a few books, around 6 books. They are available everywhere on the leading bookstores like Amazon, Flipkart, everywhere. And a little, if you want, I'll just share what books I've authored. One is Herbal Healers. That was my first book, came up in 2005.
Mhm.
And then that relate to all the herbs, the natural kitchen, the herbs that we're using, and what are the natural properties, what are the uses and benefits for one and all. Then my second book came up in 2007, that is Home Remedies
Oh,
to cure and prevent common ailments.
mhm.
So around 100 diseases I have taken up in this book.
Oh my God.
And then that what how you will know that you are suffering from this kind of problem, and what are the remedies pertaining to these problems that are actually offered by our kitchen ingredients only, our herbs
Yeah.
that we use so easily. Then third one is a little different. That is healing through Ayurveda.
Uh-huh.
That is about the three personalities. We are either Vata type or Pitta type or Kapha type, and then it is about that what kind of a person you are, your type, your mind and body. You should understand what kind you are, and then take over the right diet and lifestyle
Okay.
accordingly, so that
Okay.
you can be well. So
Nice.
more on healthy living only my work has been. Fourth book has been on again the kitchen herbs, that how they can impact your health. So it is more details about that only, healing through Ayurveda, herbs in your kitchen garden. And fifth is healthy living through dosha healing. So
Okay.
these are just the three doshas, Vata, Pitta, and Kapha.
Okay.
And then this book is a sequel with the earlier book that was healing through Ayurveda.
Okay.
And this tells us about the personalities. This is more of a story type. I've tried to make it more consciously, try to interact with the younger ones, the younger people. They can understand themselves much better, and they will know that what kind of diet is good for them and what kind of a lifestyle they should implant in their life, so that they can be living healthily. That's how. And my sixth book is, as I just told you, I'm a poet also, so that's on poetry. That's the name is uh, Silent Musings, that which are, that which were, and that which will be.
Oh,
It's all
nice.
amazing,
Oh, nice.
available at
Is there anything
Amazon.
on sleep, ma'am?
No, I'm
Ah,
not.
okay.
I've not written any poem on sleep, definitely.
Mhm.
But yes, like that's a good idea in itself. My book is available at Amazon India. Thank
Oh,
you.
all the
Yes.
best, ma'am. Fantastic. I was just going through a few of the video channels in YouTube. I think you missed out on that. I know that this is a huge list, but your many actually on insomnia or any other health related issues, there are many YouTube presentations also. So it's not that you are ending up with being a speaker or a writer. You are actually a profound YouTubian, right? Ma'am, today's session we are actually going to talk about sleep, and we have promised to our audience that we will take up the issues related to sleep. Uh, we have already, count of one, two, three questions with us. I would take the first question. What is that sleeplessness means to you?
Sleeplessness actually means that either a person is not able to sleep at all.
Hmm.
Whenever I talk to audience, you just told me that I'm a speaker. I talk to large amount of audience, and I normally ask them that what kind of problems they're facing, and more than 50% would say they cannot sleep well. So this is a big issue. So sleeplessness relates to either the person is cannot just go to sleep, or he even if he is going to sleep, he's not sleeping well at all. Then these two issues have to be taken up.
But why? Why do you, ma'am? I understand what you said, but then why sleep is so important in our life?
I'm an Ayurveda consultant, and in Ayurveda, the three pillars that take up care of our health. So you have to take care of. One is your diet. I always speak a lot about diet also,
Yeah.
about a lifestyle that imparts the exercising part also. It
Hmm.
has to be, because a total detox is needed through your body.
Hmm.
And then the third one is the third pillar, is sleep. Proper rest your body should get. Only then you can work out properly in your life. That is
Okay.
why.
So actually, these three pillars are really tripod of our life.
Definitely, definitely.
And ma'am, if time permits, we will come back to your other thing that which you spoke about, Pitta dosa, Kapha dosa,
And
and
Vata dosha.
Vata dosa. If
Yeah.
there is any
Yeah, yeah,
relationship
yeah.
between these two,
Sure.
if time permits, we will get into that. The second question, which is again maybe a followed up question, that how much sleep do we need to have to feel energized, to feel good about ourselves?
I think if we can sleep well throughout the night for 6 hours to 8 hours, that is
Mhm.
just sufficient.
Okay.
If a person can sleep well, and then in the daytime he can have a small nap also if he wants to, if he is more accustomed to it. But then that is sufficient for, as per Ayurveda, that can be suggested to a normal human being.
But ma'am, today's lifestyle, 6 to 8 hours is almost like one third of our lifetime we are supposed to sleep. But can we really afford to sleep that much in our today's lifestyle, today's generation? I'm sure those who are there watching our live video, they will be agreeing with me that in today's scenario, you are really in rush. You don't have time to eat, you don't have time to dream. So I don't know how much really we can afford to have sleep. Is there any advice from your side for that? Yes, 6 to 8 hours we must have for our body's rest or something like that. What is that you advocate to?
So I would say that yes, 6 hours is sufficient. If you can
Okay.
go for that,
Uh-huh.
stretching over is maximum is for the 8 hours time.
Uh-huh.
But then yes, it is something so common nowadays. The youngsters feeling these kind of problem. Sleep issues are coming up so much. Basically disturbed sleep they are having, or they cannot sleep well. But it is going to, because your next day rests on what is your day to day, and it has to be, you have to sleep well. Only then you can be fresh the other day, you can take up the responsibilities and whatever you want to give yourself a healthy living. That is only possible if you sleep well.
I completely agree, ma'am, because recent studies says that 87% of the Indians they actually agree that sleeplessness impacts their health. There is, ma'am, third question. I'm finding lot many questions coming in. Uh, so they say that is there any relationship between headache and sleeplessness? Is there any? I think that it is. Is there any relation between headache, migraine, such sort of common ailments and sleeplessness?
Sleeplessness relates to lot many problems
Okay.
that can come up in the system.
Uh-huh.
And it can be, the sleep issues can relate to just having a disturbed sleep, or it can be, delay in sleeping. You're not able to sleep well, you're just
Oh,
rolling in the bed.
okay.
But then if this problem lingers on, then
Uh-huh.
the problem can be insomnia
Oh,
and sleeplessness totally. And then when the person is having these kind of issues, then the health also
gets
comes into,
impacted.
yes, that is definite. So at that time, yes, headaches definitely. It could be migraine headaches, it could be some kind of allergic headaches. This is going to result from that. And other than that, the person will be having low energy throughout the day. He will
Okay.
feel lethargic, he will feel, you know, uh, less focused in whatever the situation is entering. So definitely health is being impacted.
Oh no, that's really interesting. I can relate myself, doctor. The way you are saying now is yes, sleeplessness impacts our health. I fully agree in terms of what you said when you said that next day feeling lethargy. At times we go through that cycle. I also relate to that. The way you very nicely articulated that if sleep is not there, probably that rejuvenation of the body is not happening, and we are not getting back to our day's normal work with that concentration or the focus. And obviously, if it is not there, it is going to impact our professional life, maybe productivity, and of course, that is needed. Now, there are many questions which are actually floating in. Thank you so much for your great response. I'm sure that you are enjoying, and we are getting the questions which are very interesting. The next question, ma'am, is that what are the symptoms of sleeplessness? How I can understand that I am going through sleeplessness as a disease or whatever it is. Give us something which I can relate to. That if these are happening to me, I'm having sleeplessness as a problem.
So, first of all, as I told you earlier, because if you're not sleeping well, first of all, it's going to impact your health and your basic existence overall. So, energy levels would be less. You will feel more lethargic. You cannot concentrate on whatever the options you have. And then the stress is just building up in your system.
Mm-hmm.
That is different. And
Okay.
then, of course, I'll just tell you that there's some physical signs and symptoms would be there, some emotional signs and symptoms would be there. So physically, like lose your body's luster. Those people who are not sleeping well, they have a very dry skin. They are not very energetic. And they could have the problems of having under eye circles. Many young girls, they come to me and they tell me that they're having this problem also. So this also relates to. And then it is surprising, but yes, there's some issues like health issues as simple as digestion problems, as simple as hyperacidity.
Oh.
So that's also coming up. And many times you can just relate it. Did you sleep? I ask the patient that, did you sleep well? They say no, we are not able to sleep well. So then the issue comes with the this pattern is not being addressed very easily. But yes, the problem is there. The mood swings are there. The relationship issues, this is again coming up so much in our Indian society and everywhere actually. So this could be there. Then the medical problems also, like stress is there, strain is there, anxiety is an issue. Along these all relate to sleeplessness. If the person is not sleeping well, the immunity levels go down.
Oh, is it?
Yes, even the hormones can be affected.
Okay.
And then these kind of problems, they just turn up. Not only this, the entire life of an individual that rests on this pillar of sleep. So it can be a life issue also. The person can have you can just think over that if the person is just yawning and he is not able to drive well, going through the rushes, and then he can lose his life. So that is why it has to be addressed very well.
Oh my God! Now that you have given the list, and I can again see that it's very very common. You have started with beauty. So I was actually looking at that. If you have to have a jovial look and feel, you have to have a good night's sleep. You have also said that it leads to a common problem like indigestion. Uh, Digestion, indigestion, it's a part of our life, and if those are the things which have been compromised, I'm sure that this is really really problematic. But the way you have taken these small instances of look, feel, and then the great chances of even meeting an accident, probably when you are inattentive while you're driving a car, or in any doing a work. And at times, doctor, though it is not there in the questions, but I'm sure many of our friends over there are doing their duties in the shift. So they are not regular in their sleep cycle, or the sleep regulation is not there. So I'm 8 hours duty from 6 to 2 o'clock, 2 to 10 o'clock, and then again 10 to overnight. So the whole sleep cycle gets disturbed, and it
Yes.
really impacts their health. I know that there are serious problem. Now, what you said, that if that is going to get impacted, it can actually lead to anxiety, and then,
Yes.
of course, insomnia and blah blah blah. Those are the medical terminologies
I
and
can understand.
your area of expertise. But I'm really concerned about that, how a small step in better or good sleep, if it is neglected, how can it impact our life in in a broader term? That's really scary. So far I was in a understanding that sleep is probably needed, but we tend to always compromise. I really don't know, after a discussion today, how many of our viewers and us, at least me, will take it so lightly. It is so serious in nature.
Yes.
We always ignore that. Okay, fine, today I could not sleep, I will compensate it tomorrow, uh, maybe day after tomorrow. But if it is so important that what you said, I was actually trying to note it down, but the list is so big. Uh, Thank you so much for enlightening us with all those concerns and impact which we can have. So, small question: what are the symptoms of sleeplessness? There are many actually. You can get to know about indigestion, headache, your skins are not glowing, you are feeling lethargic, and you can tend to end up with meeting an accident, which I am sure that we don't wish to, or less productive, so that it can actually hamper our professional career, right?
Right.
Thanks, doctor. But there are again questions are pouring in. The next question says that what how do you define good sleep, or the circadian rhythm or sleep cycle? I think that this is what you have already addressed, that
Yes.
every day we should have 6 to 8 hours sleep. If we miss it out, probably we will miss it out our life, right? So enjoy sleeping. That's what probably the right way of
Yes. You
talking
should
about it.
sleep well.
Yes, sleep well. The next question is that what is the difference between sleep and sound sleep? Is there anything like that?
No, the sleep can be, multiple ways of sleeping. You could have a disturbed sleep. You could not be sleeping well. But sound sleep, because in sound sleep, that is the real sleep you'll be having. That time you would not know about the surroundings, know about anything else. But then you have to, be able to actually get into sleep, and getting into sound sleep that won't last the whole night long. That won't last for the 6 to 8 hours, but
Mhm.
yes, for whatever the time, this is going to definitely impact your everyday performance.
Okay. So, ma'am, what I understood from you is that our not only our body but our internal body is also dependent on the sleep. So we really need to
Yes.
have we need to consider it as a very serious thing. And but before getting to another question, there another way of questioning is coming. Right? What are the good practices you suggest for sleeping?
For sleeping, I always say that sleep is the time at night, but the whole day as you carry yourself, that actually matters. So, starting with the day, like try to make your cycle early. Try to get up on time early. In Ayurveda we would say the time is Brahma Muhurta. Brahma
Okay.
Muhurta is at least 3 to 4 hours
Uh-huh.
even before sunrise.
Okay.
I mean, if we can actually get our bodies used to it, that would be wonderful. This is the best time when the students also, they can also
And please,
study.
sorry, ma'am,
Yeah.
repeat that. What you said?
Brahma Muhurat.
Brahmahorat.
Yeah,
Okay.
that's the best time to wake up early in the morning. Your bowels can get relieved much easier.
Okay.
And then some exercises needed. You have to sweat up also. I always suggest yoga poses for that. If you can go into sun salutations,
Mm-hmm.
that is the Surya Namaskara.
Okay.
That is wonderful. And some pranayama techniques also. These are the deep breathing techniques you should be taking up, so that this is going to impact your entire life. And then if you're healthy in the daytime, nighttime you can sleep much better.
Mm-hmm.
Then of course, like if you can lose sweat, then
Mm.
detoxification your body will get.
Oh,
That is how it is going to help you so much.
that's very nice.
And then your mind is also, because I'll just repeat that in yoga, once you take up the yoga poses, and after that go into techniques like yoga nidra.
Mm-hmm.
That is very much
Relaxing.
relaxing for the mind and
Absolutely.
body itself.
Nice.
And or shavasana also, that
Mm.
can be taken up. And then yeah, like you can sleep well after you are taken up your entire body. And then diet also, I always say the diet you have to take care. And 3 hours evening time especially,
Mhm.
you have to take care that 3 hours before you go to bed, you should finish up with your dinner.
Oh.
That is so much needed. So take up this kind of diet and take light diet. Please do not take, I always tell them that please do not take any caffeine product at that time. No tea, no coffee, no chocolates, because that is going to interfere with your sleep cycle. So that is why. And then try to make yourself more comfortable. Some kind of a soothing music. Light, the light impact should be less.
Okay.
You should not be, you have to disconnect from the your smartphones, from laptops, television, whatever. So relaxing mode, you have to make your body come into this kind of a cycle.
Oh, so you're saying about the conditioning the body,
Yeah,
so that it
it
feels
is ready.
that
It is
ready
ready
to
for
sleep.
the sleep. Yeah.
Oh, nice.
And then and also in a good mood also. So try to be with your loved ones, try to be with your children, and so that impacts a good emotional balance to your mind.
Oh,
So that you
yeah.
can sleep easy, sleep relaxed. That is how it helps.
So you're
you
saying
so
that
much.
calmness or the reducing the
Yes.
anxiety will actually help us to sleep well.
Yes.
So when we are nearby or near one,
Yeah.
we always feel happy.
Yeah,
So
definitely.
it's
definitely.
more of mooding, upliftment of our mood,
Yeah.
feeling happiness, feeling excited, and that helps. Thank
That
you so
helps
much.
a lot.
Yeah. And today I though it's a ask me anything, but for me, doctor, this is the biggest muhurat to learn, and
Nice.
Brahm Muhurat is one thing which I learned from you today. Now, while you were addressing my previous question, there is one question which came up, and I'm sure that you are actually addressing that. So someone is writing that I get up at 2-3 times in the night, and probably I can relate that when you said that before 3 hours or 4 hours one should not have tea, caffeine, that very stuff.
Any kind of a food also.
And is there anything like
Yes.
that? Do you think that this is related? Because I'm not an expert like you. She says that I get up at 2-3 times in the night. How can we stop?
So the best I would suggest is that if you are into this kind of a problem, because this is a problem definitely impacting your health, so try to take some kind of other than following all these diet and lifestyle tips I just gave you, you should take some kind of sleep inducing therapies.
Okay.
Or some kind of ingredients that could help you so that you can have a proper sleep at night. That is very much needed.
Would you like to give some clue about some natural products or the ingredients which will be helpful for our viewers to identify which are the key things, like the way you said that no to caffeine, go to early bed, or do a surya namaskar, something like that.
So, one ingredient, what I would say, is chamomile.
Okay.
So, I just said that you should not be taking caffeine, but at night before going to sleep, chamomile tea is very good for you.
Oh, nice.
One of my patients, and she asked me, okay, I can't remember the name. I said, okay, chamomile. Just remember, it's going to impact your sleep. So just remember the S of sleep and mile, so smile.
Oh,
That's
so
all.
nice.
So this helps to induce sleep actually, and good for the anxiety also. So then you should be, the person can be taking this ingredient at bedtime. This is going to help. In Ayurveda, we would already suggest that you should take some turmeric milk,
Okay.
kachi haldi. You take it in the milk, and you can add some saffron also in winter season. But yes, chamomile is definitely going to help. One ingredient I would suggest.
Sure.
Ayurveda suggests tagar. Tagar is another herb.
Okay.
Wonderful herb. So that is known as valerian roots.
Okay.
So that is also the roots and the rhizomes are used of this herb, and then it has a impact of inducing sleep.
Okay.
Sleep mode in the person who's having this kind of problem. So even for stress, releasing the stress in the body.
So the calmness will be there.
Yeah, calmness and rejuvenation, relaxation,
Okay. Oh,
everything
nice.
you get from this.
Uh-huh.
And there's another one that is passion flower. That is in India we are taking this flower from the northeast.
Yeah, I heard of it. Yeah.
Right. So then this also helps because this helps you to have a good sleep cycle, and then how it is so much useful. Otherwise, like in Ayurveda, we always suggest ashwagandha. Ashwagandha is these are also some roots and of this herb, and this is used for ashwagandha. The name is because ashwa means a horse. It
Okay.
smells like the
Oh,
horse.
smell. Okay.
So, but it is a good tonic for a person who's having this problem.
But it is very difficult to find out one another ingredient here and there. Would you recommend or would you suggest for any such thing where one can get actually, whatever is needed for them, which will assure them that there is no addiction? Because whenever we heard people about, sleeping issues, there is always a, problem which is there in their mind that uh, is there anything where I can be out of addiction yet I can take relief of or get relief of sleeplessness? Do you recommend anything such things, such products?
Actually, lately I have come to know about a product. The name is Sleep Right Shorts.
Oh, okay.
So this is most of the ingredients I just told you about. They are available in this product.
Okay.
I was actually amazed because I don't think this is a medicine of any kind. It is basically a lifestyle product.
Okay.
The teenagers are facing these kind of problems.
Uh-huh.
So you can easily have it from the. I think it is available. On the some of the retail stores or online also, but then just one shot you have to take, and then you can have a nice sleep forming. The best part what I like about it is the wellness products. It does not uh, you know make you have into put you into habit of taking it every
Nice.
day. It's not
Nice,
habit forming
exactly.
at all. It is not containing any medicine. So I think this is good enough.
So it helps them to sleep naturally.
Yes, they can very much sleep naturally.
Because there are many questions which are actually talking about that, and I'm sure that your response to them will be similar. Someone says that 6 to 7 hours sleep, still feeling unfresh.
Yes.
Then says that feeling dizzy in afternoon. I'm sure that the complete sleep was not
Yeah.
there, right? Then someone says that no quality sleep. So there, the the problem is almost similar what you said.
Almost similar, yeah.
Yeah.
And if they can follow and they can take up these kind of ingredients and follow these lifestyle tips also, then they can.
So how many days do you recommend that these shots which you said, sleep right shots, should be consumed? Is it for 4 days, 6 days?
At least once a week would be needed if the person is having this kind of problem.
Okay.
Or otherwise, take it for 2 days, 3 days. Let your body work well.
Oh, nice.
Come into the phase of the proper sleep cycle is,
I got it. So you're talking about the correction of the sleep cycle.
Yes,
so that
yes.
at the right time they go to bed and then they have that
Yes.
proper sleep pattern, and then they get fresh or
Yes,
the morning
then they
comes.
won't be having the
Very
problems
nice.
otherwise.
Ma'am, there are many questions which are coming up. I don't know how much time do we have. We have promised to be there till 4:30, and we have 2 more minutes
Okay,
to spare.
that's
So
all.
I'll just shoot few questions which are already there, and
Okay, yeah,
I know one is that is it safe for lactating mothers or pregnant women?
I would not suggest for lactating mothers and pregnant ladies, please, because I'm not sure that this product would be available for them. But yes, mostly I say that in this stage we should avoid any kind of medication.
Okay. And ma'am, what will be the age group where they can be given? From 18 to 80, anybody?
Yeah, anybody can take. Otherwise, because this problem is faced by any age group. Now, earlier it was only for the elderly. Now they are also facing this problem. The women are also facing. Even the young kids are facing. So they can easily 18 plus they can take this problem.
Okay. I honestly don't think that there are many questions which you are actually sending across. Due to the time slot, we have only 1 minute, and I'm taking the other question. But please be there, stay with us, and we are assuring you that we will respond to each of the questions by Dr. Sonika herself after the session is over. So the last question, doctor, someone says that I have a hectic schedule and bad sleep.
Okay.
What is the remedy I can have?
Okay. So the remedy I just told you, I think I
Sleep right shots.
Sure about that. Yeah,
Okay.
sleep right shots. You can be taking this as a remedy for yourself. Just take till the time you get your cycle back. Your
So
sleep
4 to 6
cycle
days
back.
one has to
Yeah,
consume.
yeah. Consume it for some time, and then let you. If you're okay with the sleep cycle, then you can of course.
And
like,
when
it's
do
not-
you suggest to take it or consume it, doctor?
That is at bedtime.
Okay.
Half an hour before going to sleep, you just take this one shot, and then you can fall into sleep. After that, you can have a very nice sound sleep, because all the ingredients I told you, they are available in this product, and it does not contain any medicine. It's a wellness product. It's good for your lifestyle.
Thank you, ma'am. But last question, the
Okay, yeah,
follow-up
please.
question on this.
Yeah.
You said that one shots at a time. It's a 60 ml bottle. Will it be nice for them?
Yeah, that is how they recommend taking this product, because just one bottle has to be
Yes.
taken immediately at one time only, as a shot only, and then for within half an hour you can have a good night's sleep actually. So that is why this sleeplessness issue can be tackled.
Thank you so much, doctor. I wish that we should have had 1 hour with our audience. They are so good. Audience is good, but more than that, the way you have actually responded to all the questions. I know that we could only address around 60 to 65% of the questions today, but I promise that we will come back soon with the rest of the 45% questions and many more, because I know that half an hour is not good enough to hear about the experience of Dr. Sonika, which she has shared about, and the need of our sleep, which is till yesterday probably it was one thing in my life. Now it is the most important thing in my
Yes,
life.
it should be.
Thank you so much, Dr. Sonika, for your time, and we are grateful to you for this.
Most
So,
welcome. Thank you so much. Thank you for listening. I'm grateful to be here for this show.